Welcome to a special edition of World Health plus Social Good. Today we'll be focusing on health issues in the Eastern Mediterranean region. So we're calling the show EMRO Health plus Social Good. EMRO standing for WHO's Eastern Mediterranean Regional Office. We're coming to you live today from Kuwait City, where they're having their regional committee meeting. And this is the equivalent in the region of the World Health Assembly that happens every May in Geneva. And we like doing social good at these meetings because that's where we can get the top experts, because the top experts from the country come to the regional committee meeting. They all work together to talk about the major health issues going on here and how by working together they can address them. Because we're here, we can pull them out during the breaks, bring them to the table so that you get a chance to talk to them as well. The World Health Organization has 194 member states, and we divide the world into 6 regions. In this particular region, we have 22 countries. Generally, it is the Arab countries plus Afghanistan, the Islamic Republic of Iran, and Pakistan. Dr. Ala Alwan is the WHO Regional Director here, and we've been fortunate to have him stop by so that he can give us an overview on some of the health issues in the region, and then we'll do a deeper dive over the next hour on some of those with the top experts. Dr. Alwan, thank you for joining us.
Thank you.
We have some viewers here who are not from this region. I'm hoping that you can start us out by giving us just an overview. What are some of the big health issues in this region?
Well, yes, sure, thank you. So the main challenges to health development in this region are 5. And the 5 challenges have been discussed extensively with the 22 member states that we have in EMRO. So one is how to strengthen health systems. And here we talk about universal health coverage. How can countries in this region achieve universal health coverage? Number 2, how can we address communicable diseases and achieve health security? Because I think member states are increasingly recognizing that health security is an integral part of national security. And thirdly, we have an epidemic of what we call non-communicable diseases, and these are the heart disease, the cancers, the diabetes, and the chronic lung disease. And these are responsible for over 70 or even 75% of deaths in some countries of the region. And a good proportion of these deaths actually occur prematurely. So people are dying too young because of these diseases. Now, the 4th priority is maternal and child health. We still have 9 out of the 22 countries that have a high burden of child mortality and maternal mortality, and they have not been able to reach the Millennium Development Goal 4 and 5. And finally, 5thly, we have the emergency preparedness and response. This region is unfortunately having too many crises. So we have at any one time at least half of the countries of the region with either an acute crisis or a chronic protracted emergency. So the work of the region is focusing primarily on these 5 key priorities.
And it's almost going to be the outline of the show, I think, but let's talk a little bit more about the emergencies while I have you here. With the emergencies, what do you find is the greatest health burden in those emergencies? I mean, having half of your countries in emergency is quite significant.
Well, I mean, the emergencies that we have in this part of the world actually affect the 5 key priorities. So we need to ensure that people during crisis, during emergencies, during civil unrest, during a natural disaster, have access to healthcare. So access to healthcare, particularly life-saving measures, is key. But because of what I said about how common the non-communicable diseases are, the heart disease, cardiovascular diseases, and diabetes, and also cancer, you need to make sure that people with chronic diseases have access to the essential life-saving services. And of course, crises result in a huge burden in terms of mental health and stress. And so it is absolutely important that we provide psychosocial support during these emergencies. Access to safe water, access to emergencies. We have about 60 million who are currently affected by the crisis in this region. We have more than half of the world total population of refugees in this region. and we have also the highest proportion of internally displaced people. So providing access to safe drinking water, to sanitation is one of the priorities. And of course, we worry a lot about infections, about emerging diseases, about disease outbreaks like measles, like polio, for example, which is still endemic in 2 countries of this region. And so we need to be absolutely sure that we have the capacity to work with the national authorities to prevent disease outbreaks, to strengthen surveillance systems in these countries.
So the regular health responses in your region don't go away when emergency starts. It just lays over on top of it. Let me ask you one last question. Some of our viewers have been following public health in the past couple years, following WHO, and they know that WHO is going through a little bit of reform to try to work better in emergencies, to try to respond a little faster and a little bit more efficiently. You have so much practice in this region responding to emergencies. I'm wondering if you have found some things that are proven to help this organization work better in emergencies, and if you've implemented them, perhaps they would be things that could be scaled up to other parts of the organization. Is there anything that you've
Well,
mentioned?
I mean, let's start from what WHO should be doing. And WHO is the coordinator of the humanitarian health cluster. So one key task that we have in emergencies is to coordinate the work, the humanitarian health work, so to coordinate all the other stakeholders, United Nations agencies, international non-governmental organizations, governmental authorities, and local NGOs. And so it is absolutely important that we strengthen the competence and the skills within our own staff, and that we have people we can deploy promptly and effectively to crisis. And that is why we have now restructured. We have now increased the number of staff working there, and we are engaged in an intensive program of training. That is one. The second issue is the importance of partnerships in addressing or in responding to a crisis. Partnerships with the government authorities. It's absolutely important that the government authorities and national stakeholders are in the lead, supported by WHO. So that is an extremely important lesson to anyone who works in crisis. And I think the third important thing is coordination. So when you coordinate, you don't actually have to lead. But you know, coordination is not just leadership. It's not being the boss of things. So how do I coordinate with other stakeholders? And so many stakeholders, so many partners that immediately come to work with the government during crisis, emergencies, I mean chronic emergencies or acute emergencies. And so you need to have the coordination skills that enable us all to work in a more effective way. And then, of course, the lesson we have always learned is how to address the issue of lack of funding, because that's one of the most important challenges that we face in emergencies. So we need to have our own funds, an emergency fund, but at the same time, you really need to find the resources and work very closely with donor agencies, with local governments, with regional governments, to ensure that you will have the funding that is necessary for life-saving measures.
Terrific. Thank you for your time. I know you need to go back to the regional committee, but thank you for stopping by and just giving us a nice overview of the situation in the region.
It's a pleasure.
Thank you. So there you heard it, a nice overview of the 5 priorities that are going on in this region, and they're really going to match the priorities that we're going to have in this particular show.